For the last decade, prescription drug prices have gone in one direction, up. A Gallup poll released in 2021 found that about 18 million U.S. adults can't afford to buy the drugs they need. One pharmacist found a way to lower those costs. Just outside Columbus, Ohio, Nate Hucks runs Pickerington Pharmacy, where customers rely on insurance to pay for their meds.
It's a traditional pharmacy.
But next door, he opened a second business.
So this is Freedom Pharmacy.
It's a self-pay pharmacy where customers pay out of pocket and can save hundreds on common meds like those for cholesterol and arthritis without insurance.
85% of the medicine that we have here in the United States are generics, and they're not expensive.
For most people,
So that's just a short clip from NBC News, and they did a little segment on the pharmacy. You can go watch the entire clip if you want. I have the link down below. Basically, this is how the entire medical system works. So not only does the pharmacy have all these overheads to work with the insurance company and all these different things that they have to put in, but so do doctors, so do hospitals. And many times the prices that are set by hospitals and by doctors can vary widely across the different insurance you have. And I agree with almost everything that they say in that video, with the one caveat being that if you have large group insurance and you are having really low co-pays, I would suggest that you actually go and ask or find out what the cash price is, and then look at your last pharmacy fill. Because many times, just like that pharmacist said, the cash price could be $10, your copay could be $2, but the pharmacy benefit manager could be charging your insurance plan hundreds of dollars for a drug that only costs $10. And what that does for your employer and your insurance plan, not many of you might not know this, but large insurance groups, they are charged based on how much insurance their employees use. I'm not saying you shouldn't use your insurance at all, but what I'm saying is if there is a way for you to save money for your insurance company, basically for your employer, then you might be able to save your rates from going up. And what that will do is it will also empower your employees, those you work with, and your employer to shop a better rate. Because many times, more than likely, your medical insurance company is making a lot of money on your employer. And your employer, how do they make money? Right? There is a top line and a bottom line. And if their bottom line can quote unquote be better by having your health insurance costs go down, maybe you'll have new equipment, better benefits, a bigger 401k match, maybe a raise. And those things are really, really important, especially with the cost of medical insurance being more than people's mortgages nowadays for just one person. So if you can imagine, if you could save that much money for the employer, you could get that much more money for yourself, for your company, and you can help grow your company and be more of a, contributor to your company in that sense. Now, for those of you folks who are on Medicare, that's my primary audience for people who are on Medicare, and they're probably wondering what they can do, and maybe we're getting away with it because of the new cap that we have on Part D. Same thing. Always ask to see if you can save money by paying with cash. It's a little bit different with the Medicare Part D program because every year the plans change. Even though your plan is the exact same plan that you've had in 2021 and 2022, it is actually a completely different plan. So any savings that you would have had by using your insurance actually go back to the insurance company and to their investors' pockets. Remember, they talked about the rebates. What the rebates are a way that the pharmacy benefit managers will say, hey, if you fill 1 million prescriptions of this drug, we will give the insurance company back XYZ dollars. I talked about this in a prior video. Basically what that does is it provides the insurance company with more money, which they in turn probably provide to their stakeholders, their shareholders, not the members. The members will not get a check at the end of the year from the Medicare Part D company. At least that's not how the system works currently. So if it is better for you to pay cash, I would always suggest to pay cash. And if you're pharmacist, it's like that guy who has a self-pay pharmacy, it's probably even better. Also, you can check costsplusdrugs.com. That's Mark Cuban's company. He kind of shows you what his costs are, what his markup is, and what his shipping costs are. You can use GoodRx, SingleCare. You can also check out Needy Meds. Needy Meds, I don't talk about them too much because it does require you to do an extra work. You have to fill out eligibility forms. What they are, they're a resource that you can try and find subsidy programs, grants, and other nonprofits that provide help for people who need certain medications. And that is something that you can use if your medications are really expensive. Unfortunately, if you're on the Medicare program, a lot of these subsidies and grants you are ineligible for just due to the fact that you're on what they consider federal money. So like if you're on Medicaid or if you're on Medicare, or a lot of times if you're part of the TRICARE VA system, you're ineligible. But they do have programs for Medicare eligible individuals as well. They're just a little bit harder to find. Alright, I hope this video helped you guys out. Enjoy the rest of your day. Have a great weekend. Do good things, and I'll see you in the next video.